you're aware, in medicine, 1 plus 1 is not always 2. There are a lot of gray areas, and there is where I was also a bit struggling because probably my mind was wanting to find something very objective, which is able to give a measurable, predictable impact. And there is where I started exploring the world of digital. And that is where I thought, okay, I could use my clinical skills. I can use the principal best practices of digital healthcare, bring it together, and see how we could uh, have some objective, predictable results in the care delivery. So that has been a short beginning to my journey in digital as well as clinical so far.
Hello and welcome to yet another episode of our podcast series. I am Pallavi Dikshit, your host, and I'm excited to have you with us as we embark on the journey to highlight thought leaders from across the vast and dynamic healthcare industry. Together, we'll dive into groundbreaking research, emerging trends, and the critical challenges and opportunities shaping the future of healthcare. I couldn't be more thrilled about today's episode because we have an exceptional guest with us, Dr. Pushkar Khair, a highly respected figure in his field. Has He has already made waves, but if you haven't had the chance to explore his remarkable contribution yet, you are in for an absolute treat. Dr. Khair is a seasoned clinician and thought leader in healthcare and life sciences, with more than 15 years of experience shaping how we think about medicine and technology. Right now, he is the head of medical education and research at Ethos, where he is doing groundbreaking research in integrating technology into medical education. Dr. Khair stands out in his ability to think beyond traditional framework, whether it's through design thinking, gamification, or instructional design. He's creating human-centered solutions that make a real difference in healthcare. He's also a master storyteller and brings in tools like neuro-linguistic programming and artificial intelligence to craft powerful digital experiences. In today's conversation, we'll delve into his journey from his days in clinical practice to becoming a visionary in digital transformation. We'll talk about the intersection of medicine and technology. So let's welcome Dr. Khair. Welcome to the podcast, sir. How are you?
Thank you so much, Pallavi. I'm good, and thank you for such a well-researched introduction. Uh, I was looking back at what all things I've been doing from what you were speaking. So thank you for bringing all that up together.
Thank you so much, sir, for agreeing to join this podcast. I'm so excited to have you here. Let's kick off things with your journey. I'm excited to know everything from the start till now. How has your background as a clinician shaped your passion for leveraging technology to enhance medical education and clinical practice?
Yeah, Pallavi. I mean, if you see my history, my father is a physician. I mean, he's a pediatrician, and back those days in school when there were very few parents who were doctors. I mean, amongst my friends, so there was uh, an assumed notion even amongst my teachers that the doctor ka beta doctor banega. So it's the doctor's child is going to become a doctor, and that way, some way, it was set upon my unconscious that yeah, I have no other choice in the career. So I uh, went on that path. I was able to secure an MBBS admission, followed by a post graduation in medicine, uh, and that path has been also very enriching. But during my postgraduate days, when I was doing my DMB in medicine, that is post graduation in internal medicine, I was very fortunate to have a very a teacher with a very futuristic vision on healthcare. Uh, he's late Dr. Sanjeev Mangrulkar, and he was the person whom I saw bringing digitization in his clinical practice way long back, and I could see the uh, amazing vision that he had in how digital can improve the overall care, the error-free clinical delivery to patients, as well as uh, physicians able to handle loads of patients without having to really think a lot or trying to memorize a lot on their history, and how the digital transformation helps in making the physician's lives easier to give accurate care to patients. So there is where my journey with clinical as well as digital started. So I really thank my teacher, Dr. Sanjeev Mangurkar, who really put in that germ of digital in me right in my postgraduate days. So that was the beginning of my journey. And of course, when you're a physician, you're treating patients, and you're aware in medicine, one plus one is not always two. There are a lot of gray areas, and there is where I was also a bit struggling, because probably my mind was wanting to find something very objective, which is able to give a measurable, predictable impact. And that is where I started exploring the world of digital. And that is where I thought, okay, yeah, I could use my clinical skills. I can use the principal best practices of digital healthcare, bring it together, and see how we could uh, have some objective, predictable results in the care delivery. So that has been a short beginning to my journey in digital as well as clinical so far.
It was an interesting turn of events how you actually got transformed into a completely, we could say, east and west, because medicine and technology is such a great mix, yet nobody thought of it for a very very long time, right? So how did it inspire you? What inspired you actually to go into that direction?
Yes, I mean, you're right, Pallavi. When it comes to adoption of new technologies, the healthcare always has been very skeptical, cynical about anything that is new coming. No, we doctors always believe that what we do is always very, very right. And no, if something else comes to even help us, we feel no, I mean, we don't want anybody to dominate the way we practice. So healthcare industry overall has been a bit skeptical or slow to adopt any kind of digital. If you see electronic medical records, right now the penetration in India is very low. While if you see in the Western world, most of the digital are, I mean, the healthcare records are made digital. I'm very proud of our government because we are so uh, proactive about digitizing health now with the Ayushman Bharat health account that everybody can have today. So I agree to your point that the beginning is always very slow for healthcare. They take very careful steps when it comes to adopting new technologies. So gradually you're seeing there is an increase in using of at least digital records to give printed prescriptions to patients. So there is digital data being recorded there. That's why I find myself lucky to be a part of this process where healthcare has just begun to to kind of wake up to this digital transformation now. And electronic medical records is just a small part of this beginning. And the way digital record keeping is going to influence and impact healthcare is going to be phenomenal in the future. That really inspired me to take upon this journey. I found myself at a very fortunate position to take this position as a clinician as well as a digital doctor, and see how I can blend the skills together to improve patient care overall.
Wow, a digital doctor. That's a new one. So you have worked in clinical practice and digital health. Like you have had the best of both worlds. What has been the most rewarding or exciting part of navigating these dual roles for you?
You know, Pallavi, when I was kind of exploring, I keep on exploring the different digital applications in healthcare. Parallelly, I also trained myself in something very interesting, and that is design thinking. Like for the corporate world in probably information technology, this is a very known term. But design thinking in the healthcare was never considered as something, I mean, I never considered at all. But I was fortunate because I work in ethos digital, and my passion. One of my mentors is also Mr. Kiran Parashar, who uh, had been instrumental in directing me towards to the big world of design thinking. And that is where I took this course in IDOU, which is a premium uh, organization for design, and I would say a pioneer organization in design. And that is where I got trained in the foundations of design thinking, the foundations of storytelling, how to unlock creativity when you're thinking of out of the box ideas. So when it comes to specifically for digital and healthcare, I find the experience design of any digital application as a very exciting part. I mean, there could be technologists who think of the art of the possible as to what is possible in the future. There are clinicians who have some pain points and needs who can express them out. But to see that it is really useful for the end user, the most crucial element is that how do we design the whole experience around this application? So for me, the design of the whole experience is a very exciting part, and that really requires all of my skills, like skills of neuro-linguistic programming, to really understand the unconscious of the end user. Just to give you an example, I mean, we at Ethos, we keep on doing a number of things in digital, and fortunately, we got the opportunity to work for rehabilitation in stroke. And that is where we had to design the experience of an application which helps in this rehabilitation or neuro rehabilitation. So here the application is great. But when we had to see that how it can be easily adopted, we really had to immerse in the senses of the patient as to how they would be able to uh, use this application so that it really benefits them. So we had to really do a structured design thinking activity so that we immerse in the senses of the patient and really see how they interact with the device and map those points and see that we bring all those points in the experience. So the experience design part is very crucial element when it comes to digital healthcare. No, it's just not creating any application is going to really change. It is going to be very crucial to design how patients would want to use it, how doctors would want to use it, how nurses would want to use it. And this thought really excites me, and I find it very, very interesting to work on that.
That is such an interesting thing to know. I think not a lot of our listeners will know these terminologies or these technologies have already entered the space and now are being actively utilized as an innovative approach in healthcare. And with you here, I think there's lot of increment of ideas and a lot of innovative people entering into the market just because people like you have already paved the path. So the healthcare industry is like ever evolving and experimenting and bringing across a lot of equipments with technology integrated into them. So these technologies like telemedicine, remote monitoring are also shaping the landscape, right? How do you see these innovations influencing the doctor patient relationship over the next 5 to 10 years per se?
Yes, I think telemedicine existed quite some time back. You know, I have a senior friend of mine, Dr. Aniket Joshi, who's actually done a specialization in telemedicine way maybe 15 years ago. However, what I found was that in COVID times, telemedicine really picked up because then the real need arose to care for patients without needing to really physically interact with them, and yet be yet be able to care for them and save their lives. So in this situation, telemedicine is really doing the great work of improving access to quality care. So today, because of telemedicine, remote areas in India or in the world are getting access to the best doctors so that they are able to consult and are able to solve problems for patients without them having to travel. So that for me is a very huge impact. Today, telemedicine can help you, have a hybrid way in which a physician, the common, I would say, objection or a common Anxiety with telemedicine is that I'm not directly touching the patient. Uh, but today, when so many equipments are available to give a lot of data for the patient, it is possible to capture those data at the point of care and transmit it to a doctor who's remotely monitoring this patient. A simple thing like a digital stethoscope right now can record digital heart sounds and digital breath sounds and transmit it to the patient, to the doctor who's remotely monitoring, and they are able to give the right advice to the patient sitting remotely. So this is just one example, but with so many data around healthcare, around a patient available to be accessed remotely, it is possible that a doctor can give quality care for patients in remote areas. So that access for me is most important. Also, a small part is that today we talk a lot about sustainability of carbon footprint. So because of telemedicine, I feel that the carbon footprint is also can also reduce because when you have to go to a doctor, you have to either take your car, your vehicle, or hire a cab, or go to that. And there is a lot of expenditure on fuel just to go to a place. But if that is also solved by being able to take care from the comfort of your home to the same level, I think we are also helping the environment by reducing the carbon footprint. So very two different ideas. I think access to good care remote places and being able to reduce the carbon footprint. I think these are the high impact points in telemedicine, I think.
I think you rightly said about the doubt or the issue that people usually have with not being able to touch or having the face-to-face interaction. So does the experience, design, or new technology that you have been involved in, does this solve these issues, or how do you think we can maintain the human touch while integrating these digital tools into workflows?
Amazing question, Pallavi. I think initially when digital records came in, the biggest challenge with doctors is that firstly they had to start learn using computers. That was the first challenge. I mean, typing was actually considered as a more time-consuming thing than actually caring for patients. So one of my senior teachers, Dr. Srirang Gokhale, he's a very senior physician in Pune, and he told me that, Pushkar, it's good to have printed prescriptions, but what happens is that I spend more time typing the things, and my eye-to-eye contact with the patient is lost. And then, although I'm giving a printed prescription, I don't feel satisfied. This was way back. He spoke to me about 15 years back, probably. But today, technology understands this pain point. Technology understands that the doctors and patients need a face-to-face time and eye-to-eye contact and empathy from the doctors. You cannot have doctors just typing. So some interesting developments are already happening in this world where uh, you really don't need to spend too much time on the computer typing things. You can actually have a heart-to-heart talk with your patient, just like we are talking right now, and everything is just recorded, just like a digital assistant who's standing by my clinic, and the digital application records our conversation, converts this unstructured data of our natural talk into structured data into different categories, like what are the presenting complaints, what is the past history, are there any allergies, and this all comes from a very natural conversation that we have, and that gets recorded into the electronic medical records seamlessly, and that solves a lot of problem for me because I can speak very freely with you without having that burden of, oh, I have to remember everything and then type it. I don't have to forget everything, and everything is done for me. So technology is definitely solving this problem by helping doctors communicate freely with with their patients, heart to heart. And as they talk, they are recording. The digital applications are recording. So, already there's an application called Nuance, an organization called Nuance, who tied up with Microsoft, who did this, has developed this application. And also, I see that there is a technology called Hello that's been developed by HealthFlix that in India. So all these things are going to be very useful for physicians to talk naturally in their natural language with their patients without having to document on their own. The work is going to be done for them, and those digital data are going to be really, really insightful for them to care for patients better.
I think language could have been an obstacle to this, but if these technology are also integrating and uh, letting them keep or record data in their natural language, that would be actually a very convenient technology to be included. If doctors are from any other state or from any other place and they are not able to interact with their patient, there can be issues with that. Also, just wanted to know, is that eradicating the need for doctors or assistant doctors or something if the tools are taking their place in transcribing everything?
Yeah, so to your first point, Pallavi, I know that language is, we have, India itself has got so many languages. But, luckily, technology is working on that so efficiently. I just let me give you an example. I was traveling to the US and I hired an Uber there. And the Uber driver there was actually, though he was in the US, he was not speaking fluent English, but he was probably a Mexican origin and he was speaking Spanish. So what he did was that he simply took out his phone and spoke in Spanish, and that application spoke to me in English. I spoke in English, and that application spoke to that one in Spanish. He understand the conversation was so simple, and today's phones are having these capabilities. I mean, very seamlessly integrated, and uh, speech to text translations real time because of internet connectivities. This is really solved the problem in which we can really converse in our own language. So I'm imagining that I'm speaking in probably Marathi, my mother tongue, and I'm catering to a patient who is coming from, say, it's from Chennai, speaking Tamil, and they are speaking their language, I'm speaking my language, and yet we are communicating right. So this is completely possible today. Uh, but so that is something which is actually I'm sure it's already handled and it's going to be even better because of 5G speeds of internet that we're getting today. The second point that you mentioned is whether it's going to replace assistants. So no, I will not say that it will replace assistants. It will replace, I would say it would substitute for the strenuous work of documentation, which is actually a burden for doctors, for even assistants. So it's like an intelligent assistant who is just noting down things for you, reminding things for you. Um, uh, Assistants will want to be there because they want to learn medicine in the physical form. They want to touch patients and learn. So it is not going to reduce their need for assistance, but the burden is going to be replaced by digital, by taking off the burden of digital. Sorry, taking off the burden of documentation by using digital for doctors.
Okay, okay. So that actually is a connecting point between the patient and the physician, and hence it is also making them feel better because they are actually interacting with the doctor. They don't have to be waiting for their prescription to be written by a tool, a digital tool, right? So that, yeah, that is something that is benefiting both sides. So, in your career is at the intersection of medicine and technology. Was there a pivotal moment or experience that solidified your belief in the transformative potential of digital health?
Yes, I can give this example probably by two experiences. One is the soul digitization. Uh, Firstly, helps me to remember small nuances about the patient, even if they're seeing me after, say, 2 years or 1.5 years. They have not seen me, and for a general physician, it becomes very important to remember very small things of the patient. So just being able to digitally record it and being able to be reminded of it simply when that interface is in front of you and the patient is in front of you, that itself helps me create a rapport with my patient. It could be a small thing that a patient must have gone to Vietnam and must have got some urinary infection sometime, and that must have been long back. And then the patient has come to me, say, after 1 or 2 years, and then I'm reminded of that from my previous interaction, and without any any need to strain my memory. I just said, no, I just talked to him. Okay, last time the Vietnam trip turned out to be some a painful experience, but probably this time you're ready to travel. So immediately it connects with my patients better because they feel that the doctor really remembers such small things about me. So that's, I know, it's a help, but something which I might not have done if I didn't have a digital support. This is just to build my patient's rapport. Other new things which I'm really seeing which are exciting is that the use of immersive technologies like virtual reality. So luckily being at Ethos, we are also into developing immersive experiences for training, for patient experience. So the pain point that we identified was that uh, when patients are sitting in the waiting room of doctors, there's a long waiting time. No, patients have to wait for a long time, and what they get with the doctor is very short time. The doctor is also burdened with so many patients, and they cannot really give the time that the patient expects from them. Yet, for example, take a knee replacement surgery. Suppose some of like an elderly patient wants to undergo a knee replacement surgery. It is something that is happening for the first time in their lives. They have so many questions. For the doctor, it is like they're doing in and out so many surgeries in a day. So it's a routine thing for them. Now to tell every patient the same things with equal amount of affection and empathy is going to be difficult for the doctor. It's not physically possible just because the energy that is needed. So why not replace this by immersive technology in which the waiting time of the patient as they are waiting in the lobby of the doctor's clinic, they are given a virtual reality experience and educated about what the possibility is after they are going to take the treatment or the surgery. What is the expected journey pre-surgery, during the surgery, post-operatively, and rehabilitation? If I'm able to tell them in an immersive, intimate way through virtual reality, it solves a lot of problem for the patients, solves a lot of problem for the doctors, because when the patient now goes to the doctor is also confident that the patient knows 80% of the things now because of that experience. And now the conversation can be very precise, specific about the questions that the patient would have. And that would save a lot of time for the doctor, energy for the doctor, yet, and the patient also would be more empowered to take more healthy decisions to do or not do a surgery. So I feel such technologies are a few technologies I would like to highlight which would transform the way healthcare is delivered.
Okay, so the next decade could actually bring a lot of changes. According to you, the immersive technology and VR, since they are getting into the space of healthcare, uh, there should be a huge requirement for people sorting out for those careers as well, right? And they should be equipped with that kind of skills so that they could completely integrate the elder generation as well as the coming generation. So with that respect, uh, what advice would you give to the youngsters who want their healthcare career to be transformed into a field such as yours?
Yes, so for youngsters who want to embark on the journey for digital healthcare, so there are a number of technologies today. So the visualization technologies like virtual reality or extended reality for that matter, it's itself a domain. And in that, if they want to go into that domain, I think it's a very exciting journey because right now there might not be a very high adoption of the virtual reality devices. But what we are anticipating is by 2030, there are going to be more affordable devices, and more people are going to really are going to use such immersive virtual reality and augmented reality devices. So that's what even Mark Zuckerberg feels, and that's why there's a high investment in Meta. Even a company like Apple invests in creating a device like the Apple Vision Pro, and that shows that there is a high value in the virtual or immersive sciences in terms of technology. Also, there could be a lot of scope in the blockchain technology in healthcare because in healthcare it is very important to have a very accountable recording of data. It cannot be tampered. There are so many laws like the HIPAA compliance, HL7, data interoperability. All such things are very important when it comes to knowing technology and healthcare. So being yourself, being upgraded on these compliances like HIPAA, HL7, blockchain, all these are going to help people or youngsters who want to embark on the digital technology for health journey. They can be really benefited by if they train themselves and educate themselves in this.
So now, when you're working at Ethos, what are the things that you are going to now include, and what are those exciting stuff that you want to bring about in your company as well as into the healthcare space? What is the most exciting thing that happening in the next few years?
So Ethos, we have been in business for over 13 years now, and we proudly call ourselves as the storytellers of science. So whenever there is any complex scientific concept that needs to be communicated, either for marketing, either for training, either for any kind of education, how we use technology and how we embed storytelling in it so that the messaging really remains with the learner. That has been our pride point, and that is where we are investing our efforts in our teams, in our projects. We see ourselves working more and more towards improving medical education and training by enabling them through digital technology. We are also focusing on creating products and improving patient experience. So this is where we are heading towards while we are telling stories of science to the helping enterprises or medical device industries or pharmas to tell the stories of science to their customers. We are also seeing how we could improve medical training and patient experience using digital technology.
That is an exciting turn of events that is going to happen in 2025 and further along the years. So, before closing, just wanted to ask you this last question that given your extensive experience, what would you consider the single most impactful digital tool or technology currently improving the patient care? Not in the future, but currently being employed in India specifically.
Yeah, so talking of India, Pallavi, thanks for asking the question. So I wanted to highlight this that the Indian government, the National Medical Council, launched this mission of Ayushman Bharat and Bharat Digital Mission, that is ABDM, is a very interesting, very, I would say, ambitious project where just like you have your account number for your finances, that we call it as a PAN number. Similarly, you now can have right now also you can go ahead and have your uh, Ayushman Bharat health account, and you can have a unique identity under that, and all the data for your health can be recorded under that, and it is completely under your ownership. It is up to you. It is not, always there is a fear about my data is going to be misused. But let me tell you, I mean, this is a bit overhyped. No, if my clinical data is going to be used without my name, it is always anonymized. So 2023 March, India has her own digital rules. I mean, the compliance rules for recording digital data. So data privacy rules for India are well defined by the Indian government. That is why nobody can really tamper with your data. But if your health data, which is anonymized, that means without your name, is going to benefit the whole Indian population by helping people to study patterns of disease, helping people to identify diseases early, or helping the government to kind of curb epidemics or stop epidemics from really spreading wide. Why not contribute to this? So I feel that having contributing to the digital mission of India by having your own digital health account through the ABHA is going to be very important. So it's called ABHA or ABHA. So today you can do that, and that is really going to help change the way healthcare is going to be delivered in India. Today, clinics can enroll themselves as ABHA compliant clinics by just doing some basic documentation online. And whatever patient's digital record comes with them, can be kind of integrated with your, I mean, the patient's health account. And always the patient will be the owner of the data. Nobody can steal your data. They can decide whom to share the data with. But having your data in one place is a big benefit to you, because you travel anywhere, uh, your health information remains always at one place. And that is such a big boon or such a big help to the doctors who are treating you. So, on the closing remark, I would encourage all my fellow Indians to have their own ADHA number and see that their health data is recorded there. It's going to be a big benefit to the whole Indian community in terms of digital health.
Okay, that's an interesting thing that I think as a youngster, for me also, I didn't know this, and thank you for updating us about this. And it has been an incredible podcast till now. One of the most amazing things that happened. Thank you so much, Dr. Pushkar, for sharing your valuable insights with us today and your perspective on digital transformation and its role in shaping the future of healthcare has been truly inspiring. Seriously. As we navigate the digital era, it's thought leaders like you who paved the way for meaningful change in clinical practice and care. That is a commendable act. Thank you so much, sir.
I feel myself fortunate to be chosen for this particular profile, and I really cherish my role at eThosh, where I'm contributing to whatever small I can. But thank you so much for having me today, and it's been a pleasure. I love the questions that you had, and it helped me really to open up to so many things which I wanted to share. Thank you so much.